It's 2013. Your child falls, hits her head.
Or you have a tingling in your arm and blurred vision.
Or persistent heartburn and nausea.
A medical emergency is not always obvious. Delayed care can mean paralysis,
Loss of speech.
heart failure,
Or death.
you decide to go to the emergency room.
But there isn't one.
St. Vincent'S Hospital was closed in 2010, replaced with luxury condominiums,
And an urgent care center.
You've been told it's an emergency room.
so you go there.
But it's not.
Real ERs have a cavalry of doctors,
Nurses,
specialists,
Surgeons.
just an elevator ride away.
ready to deliver brain-saving, heart-saving, life-saving care in seconds.
This so-called emergency room, however, is isolated.
It has no hospital attached.
No cavalry.
It is there only to stabilize and transfer patients to a real hospital. So when you get your child to this place, you wait. And then the doctors tell you,
We think your child's brain is swelling and bleeding,
now it's an emergency.
She needs immediate surgery.
or she will die.
So she's loaded into an ambulance for an agonizing ride through New York City traffic to get her to the real hospital.
And as the ambulance gets stuck in gridlock,
Time ticks by.
Nobody can tell you if you'll get your child there in time. There are over 1 million residents and visitors on the Lower West Side of Manhattan each day.
61,000 people were treated at St. Vincent's ER yearly.
over 13,000 required immediate admission to the life-saving units.
Just an elevator ride away.
13,000 lives.
13,000 lives.
13,000 lives.
And at St. Vincent's Hospital, there were 350 beds filled with sick patients.
Every day of the year.
Now, for the first time in over 160 years, there is no hospital,
From Battery Park to 58th Street.
No emergency room.
no neurosurgeons,
No trauma surgeons.
no cardiologists,
No pediatric intensivists.
No backup.
no cavalry. In this new so-called ER, there are just 2 beds.
They call it a hospital.
Just 2 beds for 1 million people.
Is that what you call a hospital?
Is this what you call adequate health care?
How can we turn our backs on people dying?
This does not have to happen.
There are solutions.
Anybody can have a heart attack or a stroke.
Any child could fall.
Rich, middle class, or poor. Hospitals have been closing all over this city. We are all in this together. Our elected representatives tell us this is a done deal.
They tell us, forget about it, get over it.
But let's turn this done deal into a real deal for the people of New York City.
My name is Dr. David Kaufman.
My name is Eileen Dunn, registered nurse.
My name is Edie Falco, and I care about my community.
Contact the mayor.
The governor
Your city council member.
and the Department of Health commissioner.
Let them know your vote depends on it.
Don't let them close our hospitals.
Don't just give up.
Tell them we need a real hospital on the Lower West Side of Manhattan. Now, and join me in making this the year of the healthcare vote. Vote as if your life depends on it. Because it does.